Knock, knock. Hand hygiene and provide some privacy. Hello, my name is Demi. I'm your student nurse. Before we jump into anything, can you please tell me your first and last name and date of birth?
Desiree Eipert, 04/17/1998.
Okay, I'm just going to confirm that on your armband. Okay, so I am here today to do a head-to-toe assessment, which is basically just a review of your systems from head to toe. It should only take about 15 minutes. Is that okay with you?
Okay.
Okay, so the first thing I am going to do is I notice that my patient is alert and she is very cooperative. She is well nourished. There is no walking system in here or wheelchair, so her gait is steady and her hygiene is clean and her speech is clear. So we're going to start by taking her vitals, and as I'm taking her vitals, making sure everything is in normal range, I'm going to ask my patient, are you in any pain?
Yes.
Okay, and where's this pain at?
My right knee.
Okay, if you don't mind, I'm just going to lift this up. Take a look at your right knee. And when did this start to hurt you?
Like 12 hours ago last night.
Okay, and what would you rate your pain on a scale from 0 being almost nothing at all to 10 being the worst pain you've ever felt?
A 2.
Okay, all right, so I'm just seeing some slight bruising, a little bit of redness. Are there any factors that may worsen the pain for you?
Just walking.
Okay, what kind of pain are you experiencing?
Throbbing.
Okay, alrighty, and this occurred last night. Okay, well, there's just a little bit of bruising and slight redness, so we'll be sure to get you some ice after, but it's nothing too serious right now, okay? So I'm going to continue with the assessment. I'm going to start by looking at your scalp, checking for evenness of the scalp and the skull, making sure that there's no dryness or any lesions, and making sure that there's no bumps or divots in her head. That part is all good. I'm going to take a look at her face, checking for the face symmetry, making sure that her pupil to her eyebrow are even. Her face looks symmetrical. I'm just going to feel along your face and just let me know if you feel any pain. Just feeling. I'm going to feel behind the ears to see if I feel any dryness or skin breakdown. I'm going to feel her lymph nodes, and her lymph nodes are non-palpable. The next thing I'm going to do is take my pen light. Just going to be peeking behind your ear to see any skin breakdown, checking inside of her ear. Her pinna color is good, nothing obstructing the ear. Take a look on the other side. Again, no skin breakdown. Your ears are all set, and then I'm just going to take a look in your eyes. I just want you to look maybe at my ear, okay? Don't look into the light though. Okay, Perla is intact. The next thing I want you to do is follow my finger just with your eyes. Don't move your head. Okay, just a couple more. Cardinal gazes are all intact. And then the next thing I'm going to do is I'm going to have you look up to the ceiling. I'm just going to take a peek in your nose real quick. There's no deviated septum. No unnecessary bleeding or any obstructions in there, and the mucous membrane is nice. It's not dry in there. And also, if you can just open your mouth real quick, I'm going to take a quick peek. Mucous membranes are nice and moist. Mouth is pink. And then if you can stick out your tongue for me. Okay. There's also her dental hygiene is good, and there's no inflammation in her gums. Can you puff out your cheeks for me? And then I'm going to just test your gag reflex real quick. Okay. And then that's all good. The next thing I'm going to do is just push on your shoulders if you can shrug them up, okay? Okay, good. So all 12 of her cranial nerves are intact, and now we are going to move to your respiratory. But before we move to the respiratory, I just want to confirm if you know where you're at right now.
CSU Pueblo.
Okay, and do you know why you're here?
For a health assessment.
Okay, and do you know what day it is?
Wednesday.
Okay, so my patient is A&O times 4. I'm going to go ahead. Actually, before I listen, I'm just going to be checking the symmetry of her chest, making sure that there is no barreling or any extending of the chest. There's no lesions or scarring. Okay, that's good. I'm also actually going to check the back too before I listen, making sure there's no moles or any scarring or any skin breakdown, and there is symmetry back there. Her breathing seems good from what I can see right here. I'm just going to take a quick listen, and if you could just take a deep breath in each movement, that would be great. And I would be underneath the patient's gown on her skin. Good. I'm gonna take a look at your back. Same 6 spots. Okay, and just 2 more on each side. Okay, and the breathing is clear and non-labored. Real quick, I'm just gonna do a quick pat on your back to check your CVA. Just let me know if you feel any pain when I do this, okay?
No.
Okay, so there is no CVA tenderness, and there's no unlabored breathing. It is unlabored breathing, and there's no wounds or any scars, and there's no CVA tenderness, and your lungs are looking great. We're now going to move on to your heart, okay? So again, I would just check her chest, make sure there's no scarring or bleeding or skin discoloration. So I'm going to first listen to your carotid artery on your neck. Okay, your neck vessels appear to not be distended. Real quick, I'm going to check the pulse too. Present on both sides, that would be a 2+. Now I'm going to listen to your heart, okay? While I check her apical pulse, I'm going to compare it to her radial pulse on each side. Her valve pulses are present and clear at a 2+, and her radial pulse is clear and matched up with her apical pulse at a 2+. And your neck is negative for any brooding, and now I'm just going to take a quick look at your hands, okay? So I'm just going to be checking the capillary refill. Okay, it's under 3 seconds. That's good. Check the other side. Okay, real quick, I just want you to squeeze my fingers. Good. Now push down on my hands. Good, and push up. Okay, strength testing is a 5 out of 5 for upper extremities, and that concludes the cardiovascular section. Actually, I'm just going to check your skin turgor just real quick. No signs of any dehydration. Skin is intact. No breakage or any scars. And now we can move on. So if you can lie down just for me real quick. Okay, so I'm just going to be checking her abdomen. I'm just going to roll this up if that's okay. Okay, first I'm going to look to see if it's symmetrical, if there's any bumps or indents anywhere on her abdomen. Okay, and the color looks good, and there's no bruising or anything. So I'm going to go ahead and take a listen to your belly real quick. And again, this would be on her skin, not on top of clothing. Okay, and bowel sounds are present in all 4 quadrants. And I'm just going to go ahead and feel on your abdomen. Just let me know if you feel any pain or tenderness, okay?
No.
Okay, good. So you can go ahead and sit back up for me. You can face me. Can you tell me when your last bowel movement was?
This morning.
Okay, and was there any issues with your bowels recently?
No.
Okay, and when was your last menstrual cycle?
2 weeks ago.
Okay, perfect. So that concludes that section. Now I'm going to move on to your legs, okay? I'm just going to roll this up, still covering you for privacy. And as I'm looking at your legs, I'm checking for symmetry, checking for the color and the temperature of the skin. Everything is looking good. Also going to be checking her legs for any signs of edema, and there is no signs of edema. I'm going to go ahead and check her pedal pulses down here on both sides. And then her tibial pulse on the back. Okay, pulses are present. That's going to be a +2. And the next thing I want you to push up on my hands. Good, and push down. Okay, good. And then I'm also just gonna real quick check for any ingrown toenails, and any bruising or any open wounds on your toes. And then check your cap refill on both sides, both under 3 seconds. And then your strength is a 5 out of 5. And that concludes our head to toe assessment for today.
Okay, so for the purpose of this video, because of time constraints, we're just going to do range of motion exercises once instead of 5 times. Okay. Hi, my name's Erica. I'm going to be your nurse today. We're going to do a complete head to toe assessment, okay?
Okay.
Okay, what's your name?
Melanie Peters,
And how old are you?
23,
And when were you born?
December 3rd, 1993.
Okay, and where are you at right now?
Cape Breton University.
Okay, awesome. So first, can I see your hands? Great. Temperature feels good. Now I'm just going to check your capillary refill. Okay, looks good. So now I'm just going to take a look at your scalp. Any tenderness? No. No bumps? Awesome. Okay, so now I'm just going to check your temporal artery. Awesome. Okay. Can I get you to open your mouth wide? Can you go side to side? And close. And clench. Okay, awesome. Check your sinuses. Any discomfort? No. Okay, awesome. Now we're going to take a look at your eyes, okay? So first, I need you to hold this card up to your eye, right? And I want you to let me know when you see my fingers, okay?
Now?
Awesome.
Now? Now?
Awesome. Okay, do you want to switch eyes for me?
Okay. Now? Now? Now?
Awesome. Okay. I'm just going to hold this card. I want you to stare at my nose, okay?
Okay.
Okay, looks great. Okay. So now I'm just going to take a look at your pupils. It's going to be bright, okay? Awesome. Okay, so now I want you to follow my finger, okay?
Okay.
Great. Awesome. Now I want you to follow my finger as I bring it inwards, okay? Awesome. I'm just gonna pull your eyelids down a little bit. Okay, looks clear, moist, and up. Okay, clear, moist. Awesome. Okay. So now I'm just gonna take a look at your ears. Tell me if you feel any tenderness, okay? Good. No tenderness? No. Now I'm going to whisper some words to you, and I need you to repeat them back to me, okay? Oh, and yeah, can you cover your tragus? Yeah, just push it under here on the opposite side.
Monday? Tuesday? Baseball.
Awesome. And switch fingers. Cover the other ear. Yep.
Monday? Friday? Basketball.
Awesome. Okay. Now we're going to take a, you're going to see your nose. Okay. Can you cover your nostril? Yep. Breathe in through it. You know? Any trouble breathing? No. Okay. And the other one? You know? Any trouble breathing? No. Okay. Great. So now, can you open your mouth for me? Okay. Your tonsils look great. Can can you lift your tongue? Awesome. Okay, can you stick your tongue out? Okay. Now I do have to make you gag, okay? So can you stick out your tongue? And can you say ah, ah? Right. Thank you. Okay, so can you give me a big smile? And can now you frown? And can you smile without your teeth? Okay, perfect. So I'm just going to check out your neck, okay? Let me know if there's any tender spots. No bumps. Okay. I'm just going to check out your cervical nodes. You can just drop your chin a little tighter. Okay. Just going to feel your trachea. Okay. Nice and midline. Great. So now I need you to take a gulp of this and swallow when I tell you to, okay? Okay, swallow. Great. Can you take another gulp? Gulp. Yep. Awesome. Thank you. Now we're just going to do some range of motion exercises with your head and your neck. Okay. So can you bend your head forward? Yep. And backwards. Awesome. Side to side. Inside. And tilt your head. Other side. Awesome. Okay, so now we're going to do it with some resistance. Oh, actually, can I get you to rotate your head? Yeah. Awesome. Okay. Now we're going to do it with a little bit of resistance, okay? So push your head forward. Okay. And backwards. Awesome. Sideways. Yep. And your other side. And toward you. Awesome. One more time. Awesome. Okay. So now I'm just going to take a look at your back, okay? Can you take off your shirt for me? Okay. Okay. I'm just going to get you to turn a little bit here, okay? Yeah, that's perfect. Yeah. Yeah, okay. Okay, so your shoulders are symmetrical. Awesome. I'm just going to feel your spine, okay? Any tenderness? No. Oh. Okay. Okay. I need you to take a deep breath, okay? In and out. Can you do it one more time for me? Okay, good. Okay, so every time I place my hands on your back, I need you to say the word 99, okay?
99, 99, 99, 99, 99.
Okay, awesome. Now I'm just going to take a listen, okay? Okay, so every time that I place the stethoscope on your back, I need you to take a deep breath. That sounded good. Okay, so now I'm just going to do some light tapping on your back, okay? Okay, awesome. Yeah, okay, so. Okay, now I'm just going to look at the front of your chest. Awesome. Just take a deep breath like before, okay? Awesome. Okay, so same thing as before. When I place my hands on your chest, I need you to say 99, okay?
99, 99, 99, 99, 99.
Okay, awesome. Just gonna feel around. Let me know if you feel any discomfort, okay? Okay, awesome. No tenderness? No. I'm just gonna listen to some breath sounds again, okay? Okay. Deep breath. Deep breath again. Deep breath. Deep breath. Deep breath. Deep breath. Okay, awesome. Okay, so now I'm just going to listen to some heart sounds, okay? Yeah, can I get just to turn a little bit? Yeah. Okay, that was awesome. Great. Okay, so did you want to? Oh, actually, that's fine. Okay, so I'm just gonna take a look at your arms. Tell me if you feel any tenderness. Okay. Okay. No tenderness? No. Just feel on your nose. Okay, I'm just gonna get your brachial pulse, okay? Radial pulse. Okay. this side, please. Good. Okay, awesome. Okay, now we're going to do some range of motion next. Do you have to sneeze? Go ahead. No, go. You're good? Okay. So now we're just going to do some range of motion exercises with your arms, okay? Okay, so I need you to lift arm up. Oh, yep. Good. And forwards. Yep. And backwards. Yep. And rotate it. Awesome. Okay. Now can you take your elbow and bend it up? Yeah. And can you take your wrist and flick it all the way up and down? Yeah. And your fingers out. Awesome. And together. And one by one, thumb to each finger. And backwards. Yep. Awesome. Okay, so this arm, so up and down and forwards. Yep. And backwards. And can you rotate it? Awesome. And your elbow, can you flex it up? Yep. And your wrist again. Up and down. And your fingers out. One by one, thumb to each finger, and backwards. Awesome. Okay, so now we're just going to do it with a little resistance. Okay. Okay. Can you raise your arm? Great. And upwards. Great. And backwards. Great. Okay. And your elbow, flex it up. Great. Okay. And your wrist upwards. Yep. Can you push down? Great. Same thing with this arm. Can you go up? Yep. And up. Yep. Sideways. Great. And backwards. Okay. And your wrist. Oh, and your elbow, sorry. Up. Great. And your wrist. Okay. Push down. Okay. Awesome. Okay. Oh, and can I also get you to pull up your shoulders? Great. And with resistance. Awesome. Okay, so can I get you to lay down now? I'm going to take a look at your belly. Okay, awesome. I'm just going to listen, okay? I guess I'll just leave it there. Going to take a listen to some vowel sounds, okay? Okay. Okay, and just once more. Okay. Okay, I just want to let you know, or let me know if you feel any discomfort, okay, or tenderness. Tenderness? Nope. Now I'm just going to do some light tapping. Okay, awesome. Okay, that's good. Okay, let's sit up now. Actually, sorry, no. Just gonna get you laid back down.
Okay.
I'm actually just gonna feel some lymph nodes down here, okay? Okay, now I'm just gonna feel for your femoral pulse. Okay, awesome. Okay, so stay down. Let me know if you feel any discomfort in your legs, okay?
Sorry, I'm just taking my socks off.
Thank you. Any discomfort?
Nope.
Any tenderness?
None, no.
Okay. Okay, great. Okay. Okay, I'm just gonna feel for some pulses, okay?
Okay.
Okay, so now we're just gonna do some range of motion exercises with your legs.
Okay.
Okay, can I get you to raise this leg up? Great. A little sore?
Yeah.
Okay, now outwards. Great. Inwards. Great. And can I get you to rotate it? Great, okay. Can I get you to move your knee up? Yep, great. And down. Can I get you to bend your foot all the way up? Okay. And down, and inwards, and outwards. Great. Okay, so this leg up, and down, and outwards, and in to me. Okay. Can you rotate it? Okay, that's good. And knee up, and knee down. Okay, your foot up, and your foot flexed. Yep. Inwards, outwards. Okay, awesome. Now we're just gonna do a little bit of resistance, okay?
Okay.
Okay, so leg up. Great. Leg towards me. Great. Leg towards inwards. Yep. Great. Okay. Knee up. Great. Okay. Now foot. Awesome. Can you push down? Great. Okay. Inwards. Awesome. Outwards. Great. Can you rotate your ankle? Awesome. Okay. Leg up. Great. Leg out. Awesome. Leg in towards me. Okay. Rotate. Oh, no, rotate. That's fine. Okay, so knee up. Okay. Flex your foot towards yourself. Yep. Can you push down? Okay. Inwards. Awesome. Outwards. Awesome. Okay. So that's good. You can sit up now. Okay. So now I'm just going to do a couple tests, okay? I'm going to grab my coffee ball.
I'll switch the things too.
That's okay. Okay. So just want you to let me, oh, can you close your eyes? And I just want you to let me know when you can feel what I'm putting on your face, okay? Just let me know when. Now. 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 Awesome. Okay, keep your eyes closed. I'm going to put a couple objects in your hand, and I just need you to let me know what they are, okay? Okay. Popsicle stick. Awesome. Marker. Yep. Stethoscope. Yep. Cotton ball. Yep. Okay, that's good. Now I'm gonna touch certain areas of your body, and you're gonna let me know where, okay? Okay. Great. Great. Okay, awesome. You can open your eyes now. Okay, so now I need you to touch your nose, and then I need you to reach out and touch my finger. Okay, again. And a little faster. And a little faster. Awesome. Okay. Okay, so now touch your own nose. Follow me. Now I need you to go side to side. Yep. Now a little faster. And a little faster. That's great. Okay, awesome. Okay. Now I need you to shut your eyes and let me know if this is dull or sharp, okay? Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Okay, that was great. Okay, now we're going to test some reflexes, okay? Okay. So, first I'm going to start with this one. Good. Tricep. Good. Sorry. Okay. Good. Thank you. This one. Awesome. Okay. Good. Good. Okay.
Maybe on that chair will do.
Okay, you ready?
It's upside down though. Shoot. Yeah, we hold it. Thank you.
And I'm going to do your Achilles. Thank you. Thank you. Just do it one more time on this one. Okay, awesome. Okay, now can I get you to stand up? Okay, so now I just need you to walk towards me. Okay, great. Now I need you to turn around. And I want you to walk backwards, but I want you to walk heel to toe. Okay, great. Now can you come towards me, but walk on your tippy toes? Okay, now can you turn around and walk backwards, but walk on your heels this time? Okay, now we're just going to do a couple more range of motion exercises. Okay, can you bend forward and touch your toes? Awesome. And backwards. Great. And side to side. Now rotate. Yep, great. Okay, so now we're just going to do it with a little resistance. Okay. So, can you bend forward? Yep. Bend up. Great. Can you bend backwards? Now bend forward. Great. Now bend to this side. And bend to the other side. Good. Okay, we're all done. Doing awesome. Thanks so much.
Thanks.